The cranial cervical flexion test evaluates longus colli and longus capitis muscles. The patient is supine, neck in a neutral position. A blood pressure cuff is placed under the cervical lordosis and inflated to 20 millimeters of mercury to provide feedback. The patient performs a gentle head nod, progressively increasing the pressure in 2 millimeters of mercury increments, 22 to 30 millimeters of mercury, holding each position for 10 seconds with 10-second rests. The test ends if pressure drops by more than 20%, or if compensatory movements occur. A normal response is achieving 26 to 30 millimeters of mercury, indicating proper activation of the deep neck flexor muscles.